Hello, I'm Jeon, a fellow from Gangnam Severance Hospital, Seoul, South Korea. I'll present my research entitled Differences in Clinical Features between Focal and Extensive Types of Cystitis Glandularis in patients without a previous history of urinary tract malignancy. This study was co-authored with Ha, Su-Jin Shin, Ham, and Choi with Kang as the corresponding author. Cystitis glandularis is a benign condition in which the bladder lining cells change into gland-like cells. It is no longer considered a pre-malignant condition of bladder adenocarcinoma, but its clinical significance is not fully understood. We have seen patients with cystitis glandularis in our clinic who have symptoms such as hematuria, voiding problems, or flank pain. The clinical course of cystitis glandularis varies from patient to patient, and there is no standardized management guideline. Therefore, we aim to understand the clinical differences of cystitis glandularis according to extent based on cystoscopic findings in patients without a history of urinary tract malignancy. We reviewed 110 patients diagnosed with cystitis glandularis at two tertiary hospitals in South Korea from 2005 to 2021. We exclude patients with previous or concurrent history of urinary tract malignancy to elucidate the clinical features of cystitis glandularis more clearly. We categorized patients into two types based on the extent of their cystoscopic findings and compared their clinical features. Focal type was defined as a tumor showing a relatively small nodular and focal features. Extensive type was defined as tumors showing relatively large multinodular and extensive features, usually involving the blood neck and trigon area circumferentially. Cystitis glandularis patients' mean age was 52 years old, and 70% were men. Most common symptoms were gross hematuria, voiding problems, flank pains. However, approximately 70% were instantly found during health checkups or workups for other disease. According to cystoscopic findings, the trigonal area was the most common site of cystitis glandularis. Imaging studies revealed urinary stones in 21 patients. Hydronephrosis was found in 16 patients, but only 6 were caused by cystitis glandularis itself. 4 patients were diagnosed with subsequent malignancy. About 30% of patients were classified as extensive type, which were typically found with huge lesions with circumferentially involved bladder neck and sometimes reached orifices causing obstruction. Most patients in this type were predominantly men, except for just one woman in our study population. They were more associated with smoking. Considering the size and location of the lesions, more voiding problems, hydronephrosis, multiple TUR procedures can be explained. 70% of patients had focal type cystitis glandularis. They were relatively older than the extensive one. More hypertension history was explained by their older age. This table shows clinical features of cystitis glandularis patients with hydronephrosis caused by cystitis glandularis itself. They were all men, and the location of cystitis glandularis was the trigon. Among them, 5 patients with extensive type showed bilateral hydronephrosis, which was successfully managed by TUR. All 4 patients of subsequent malignancy were from the focal type. It's not clear that it was missed on initial workup or occurred later. All cases of urinary tract malignancy were urothelial carcinoma and no adenocarcinoma was observed. There were significant differences in the clinical features between the extensive and focal type cystitis glandularis. The extensive type was more commonly associated with urology complications such as voiding difficulty, hydronephrosis, and multiple TUR. Base sex and smoking may be associated with the extensive type, while relatively younger age suggests that genetic factors may play a role in the pathogenesis of the extensive type of cystitis glandularis. Meanwhile, subsequent urinary tract malignancy was observed in several patients with focal type cystitis glandularis. Thus, thorough initial workup and careful follow-up is necessary despite the benign nature of cystitis glandularis. Like other benign bladder tumors such as inverted papilloma, annual surveillance cystoscopy may be appropriate. Thank you for your attention.